Okay, well, welcome to our breakout room. This is breakout number 1, and we're focusing here on response capacities. My name is Ken Kester from Sanofi Pasteur. For all, as in all the breakouts, and we only have a limited period of time, I think it's a half an hour. The focus here is to develop a list of some short-term goals, as well as some longer-term goals. Short-term, say, things that might be actualized in perhaps in the next 2 to 3 years, to design some better response frameworks, and then some longer-term goals, and that's sort of big picture, say 10 years or perhaps more, to develop new response techniques and capabilities. And so the intent here is to identify key actions, relevant institutions, and stakeholders. Just a very small task for half an hour. So, I think what we'll do is I'm going to ask, rather than me, just going through this, each of our participants just to briefly introduce themselves, where they're from, and then let's go through this as efficiently as possible. I know there's been some information that's been shared, and so let's try to keep this as very point focused so we can capture these, recognizing there's a lot that goes behind the thoughts that'll be put out. So let's see. So let's start. I don't know how everyone's on the screen, so I'll just call on you, and you can introduce yourself, and then we'll move on. So let's see, Michael.
Yes, good morning. My name is Mike Wilkes. I'm a professor of medicine and global health, involved in curriculum development. Perhaps for this session, what's most important is that I work as senior medical correspondent for National Public Radio, and have spent a huge amount of time covering SARS-CoV-2 with a global and One Health perspective.
Okay, and you do have an NPR voice. Very good.
Very much. Nice.
So, Kaylee.
Hi, everyone. I'm Kaylee Arica-Borde. So I'm a policy researcher and a veterinarian. I work for the Human and Animal Interface team at WHO headquarters, and then I also have a faculty appointment with the University of Minnesota.
Great, thank you. Catherine?
Hi, everyone. I'm Catherine Michalova. I'm Senior Policy Advisor and Senior Scientist at ECOTH Alliance, and work with many intergovernmental partners, especially on the wildlife and environment side. Great to be with you all. Thanks.
Thanks. Peter?
Hi, I'm Peter Rabinowitz. I'm a physician and I'm a faculty member at the University of Washington. I direct our Center for One Health research, which is one of the very few One Health centers in a human medical and public health complex. And I think one of my missions is to really kind of mainstream One Health and get it more on the agenda of human health and public health.
Great, thank you. Olga? I think you're on mute. You're still on mute, Olga.
Sorry. Yeah, I'm Olga Jonas. I'm in Cambridge, Massachusetts. I'm a senior fellow at Harvard, but I worked at the World Bank for 33 years as an economist. And during the last 15 years, I became very much involved in I was the coordinator of the avian flu response, and so I learned about public health and the issues around health security and health sector management in general. I'm retired from the World Bank, but I'm still very much interested in this, and I look forward to the discussion.
And thanks for the things you sent around.
Anytime.
Okay, Victor, you're next.
Morning, evening. Can you hear me?
Yes.
Yeah, this is Victor. Greetings from New Delhi, India, where I'm sitting. I'm with WHO, the Southeast Asia Regional Office, and I'm coordinating for the region, the Global Outbreak Alert and Response Network. Over to you.
Great, thank you. Okay, so we have a little bit less than half an hour, and so 2 easy goals, some short-term goals and long-term goals.
No problem.
Yeah, so let's just kick it off, and maybe Olga, you've already put out some thoughts. Maybe if you want to start there, and then we can kind of go around the room. We'll try to divide we'll try to divide the time up equally between short and long-term goals, and we'll see how we do. So Olga, do you want to start?
Well, my thinking on the short-term goal and also on the long-term goal is that with COVID-19 and the, the sort of the catastrophic impact it has been having, and it has, there is a real opportunity to raise awareness of sort of policymakers at the Ministry of Finance level, leaders of of countries. That's really unique. Okay, this is like everybody is suddenly aware that there are pandemics, which was not the case. Say 5 years ago, it was not something on their radar. So this is, there's a great awareness of the risk. So we should take advantage of this moment that there is this awareness and the openness to do something about the next time, because I think that's very well sort of communicated that this is a long-term sort of continuous problem that has to be institutionalized. The response to it has to be a sustained kind of effort, not something that's ad hoc. And so the short term is that it's motivated by the notion that the macroeconomic risk to the global economy is very large, right? I mean, the IMF is estimating whatever 6% of GDP, of global GDP in just 2020, and there'll be more sort of impact in 2021 if everything ends soon. And if it doesn't, well, anyway, so there is an awareness that this is extremely costly at a macroeconomic level. And therefore, the people who are in charge of mitigating risks to the global economy should do their part by monitoring, and they monitor government spending as part. I mean, that's the mandate of the IMF. And as it is, we don't know how much is being spent on this problem. I mean, the data are very weak, and it's just some study collects ad hoc data about the effort being made. There is an awareness that IHR are not complied with, so there are efforts at WHO to monitor it better, but it's very much sporadic and it's not sustained. But if you put it as a job for the IMF, then I mean, not you, but the leaders, the owners of the IMF, the countries, that this sort of spending on public health capacities is critical for mitigating this risk, which is very large. Then it will be the situation will improve, because if somebody is watching this every year, which is what the IMF is tasked to do, then we'll be in a better position in 5 years, in 10 years, because at least there will have been attention to the effort that's being made to reduce pandemic risk, which countries should be spending on core public health functions such that these functions actually function the way they are supposed to.
Okay.
And they can, at this moment, they can learn, people should know that pandemic crises can be prevented by having these functions. And if there is an awareness, then they have to monitor is enough spending on these functions. And they can do that routinely for every country, because every country is subject to annual reviews of their fiscal spending. And pandemic risk mitigation has not been part of it. Whereas climate change has, for like the last 5 years, is part of this review by the IMF, right? So that brings the attention of the finance minister, of the leader of the country, and it will not be neglected and sort of forgotten and sidelined, which has been the history. Anyway, so that's the motivation.
Good, good. A nice kickoff. Someone else want to add some tangible short-term goals?
I'm just wondering if we could propose that if we push for funding like this, can we really create a framework for pushing the funding through a One Health mechanism so that you start off right in the beginning, adequately funding both veterinary and public health, and you don't sort of start off in funding silos right from the beginning. Can we really sort of push for a kind of a reimagining of how these funding mechanisms would work on a national level and an international level, so that you get this integrated approach right from the beginning, and you don't leave out the environment, you don't leave out the veterinary, animal, wildlife side, and you start running things through a One Health sort of funding mechanism somehow.
Okay, I see. I want to call on Kevin Anderson, who's joining us from Homeland Security Science and Technology Group. Kevin, anything you want to add for short-term goals? You're on mute. Okay, I guess. All right. Well, let's move on. Michael.
Yeah. So I'll add something that's a little bit out there. I agree with what Peter said. I would just remind everybody that while many of us come from medicine and veterinary medicine and environmental health with doctoral level degrees, that there are lots of other health providers, particularly around the world, that are equally important to include. But my point is more around health literacy and health communication, particularly risk communication. And, I think we've done an exceptionally poor job around the world, but particularly here in the United States, at reaching out to diverse populations and engaging the public. And I think it sort of backfired on us in terms of, not only testing and precautions and prevention, but now with vaccines. And I think that from a long-term perspective, we really need to begin to develop strategies for starting early in school, helping young people develop health literacy and numeracy so that they can understand risks and numbers in a real practical way, but then having a strategy where we can involve opinion leaders and reach out to communities, use new ways of thinking around social media, but to really engage the public and get them information that's trustworthy, that's transparent, and that we're honest. When we don't know something, we tell them that we don't know something and why we don't know it.
Good point. Anyone else? Go ahead.
Chip in, perhaps. Oh, no, sorry. Go on. I'll stay back.
No, just very quickly. So building on what Michael mentioned, I think there's a space for talking about a short-term goal for workforce development. So we have this powerhouse of international policies and frameworks and monitoring and evaluation tools from across the tripartite and others. And one thing I realized is that we don't always allow these individual health workers in this One Health space to fully understand their role in supporting that at the multiple levels of the system, from the community upwards. And so I really feel like there's these resources at the tripartite and the international level that can come down and train people from the ground up to see themselves as like active participants in this global goal. So over to Victor.
Thank you very much. Actually, very much aligned with what you just said. And I mean, I really like the of course, the presentation.
Am I unmuted now?
Yes, you are.
Yes,
Can you hear
are.
me, Kent?
I can hear you, Kevin. Kevin, I'll come to you next, okay?
Yes. Shall I continue?
Go ahead, Victor.
Yeah. No, as I said, fascinating presentations, but I found, apart from a couple of quotes and of course, I found a huge focus on technology, and I'm glad that we have in this panel about response, because response obviously relies entirely on the workforce, and I entirely agree with many of the comments that have been said about the workforce. That is not only the usual profiles that we think of in the middle of a pandemic, epidemiologists, lab, and the rest. There are many profiles there that we need to include proactively, and we don't. But my first perhaps suggestion for a short term is do we really as as Kaylee was saying, do we really know the human resources across the different domains that might be capable to, respond in an outbreak like the one we are facing? I know the answer already. For many countries, that is not the case. So I'm just wondering, we should not start mapping the different capabilities in terms of human resources across the different domains, and what level of resistance or what level of response can they provide given different levels of shocks, and what is the risk tolerance that we have against those shocks, and what levels of resources we require. But mostly focusing on these human resources. Technology, of course, will develop in its own. That's all from my side.
And that certainly goes with the concept of workforce development as a broader concept. It's not just people who are employed in particular institutions. It's community, and the comment before about community engagement, community access, right? Understanding kind of the whole breadth. Kevin, if you can hear me, want to pull you in, see if you have any thoughts on some short-term goals on response. And right now you're muted. Still muted. Okay, well, we'll come back. Catherine, any thoughts?
Yeah, I think, just adding to the discussion about existing workforce and resources we do have in the short term, I think mobilizing groups, humanitarian sector that are at the ready when we have an earthquake or these natural disasters. I think we can use a lot of the lessons learned from those and the partners that are already on the ground and really effective at coordinating, with food security, with livelihoods, kind of in the moment that you need these resources to complement your clinical response. So there's a USAID Ready initiative, which I think is trying to do this with great intention, and all around the world that on the ground really needs to happen, and to bring in risk communication and all these things that we can do ahead of a pandemic when we can, gear up and be ready for all of these multi-sectoral needs. I think also that kind of raises the question of what are we responding to? Is it just the outbreaks? Is it just the human impacts or animal impacts? But also the threats that we see really upstream and can kind of begin to predict. So I think the readiness to respond to threats is as important in this dialogue. Maybe that goes to longer term goals, but I think it needs to be part of the discussion in terms of what we know already and can do immediately. And then I think for short term, identifying the blind spots. So we've talked a lot about the really important global intergovernmental frameworks, but there are definitely blind spots there when we look at environment sector involvement and capacity of wildlife health systems. And I think we need to be really candid about what those are and look systematically about what we're missing, and then make sure in the long run to bring those in. Thanks.
Yep, very, very nice. And actually that dovetails again with what Victor said. It's not just the technology. I mean, there's a lot of good technology that's out there, but some of these things, I don't know that you would characterize them as quote unquote soft skills. They're not, making mRNA and other stuff like that, but these are critical things having to do everything from logistics to human resources to just, all the other aspects that are really necessary, as we've seen in the COVID situation. Kevin, I see you're unmuted. Can you hear me? Now you're muted again. Okay, we're trying. Let's again, with the artificial constraint that we don't have a whole lot of time, let's try to hit some longer term goals. I think we recognize that this is really a continuum, and short term goals, are just one part of the solution that hopefully is heading in the right direction for something more actionable in the future. So let's try to some thoughts on some longer term goals. Let me call on Brianna. We haven't heard from her. Sorry about that.
That's okay. One of the things I've noticed when I speak about One Health in various audiences that we do consider veterinarians, we consider physicians or, MDs, we consider biologists, and even maybe some environmental professionals that have to do with the physical environment. But one thing I do see is lacking a lot is the social environment. A lot of those drivers definitely impact One Health, particularly with humans and their attitudes and behaviors. And that spills over into the other two, which is the animal environment as well as, the environment, like climate change and things like that. So I think it's very important to also maybe target the social scientists, maybe like anthropologists, maybe like those that study psychology, things like that. So I think we need to also target them.
Okay. Peter, you have a comment? You're muted.
So two quick things. One is that in terms of blind spots, I think we really do not have agriculture at the table. And agriculture is a global, I mean, it's trying to feed up to 8 billion people. It is having a huge effect. It is a very centralized thing. And it is affecting so many of the pandemic risks, and we have to have them as part of the thing. And I think the other thing is, as we make up this list of short and long-term goals, I just think we have to remember that we have a special opportunity. This is a One Health meeting. There will be a lot of other pandemic meetings that'll talk about pandemic preparedness and things, but this is really a chance to say why a One Health lens would be any better from a non-One Health lens, I guess. So stop there.
We certainly hear about agriculture when there are famines and droughts and things, and then it recedes into the background. Kaylee, comment?
Yes. So this is slightly different, but for a long-term goal, something I've been thinking a lot about is research and organizational development for the One Health platforms that have been rapidly developed at the country level in many countries around the globe. And to your point, bringing in agriculture and ensuring that actually many ministries who are not equally resourced have opportunities to bring the right people to the table and be in these leadership discussions, even when they're constrained through their human resources, financial resources, time resources, but to make this sustainable. So one of the issues I think we're facing is that as international donor funding has gone into the rise of these platforms, then how do we help countries maintain them at a national level and do that sustainably? So something to put on for long term.
Okay, thank you. Anyone else? Long term, we have 5 minutes, maybe a little bit less.
Just to build on what Kaylee said about workforce development, I just really liked what Jonathan Quick said this morning about the having astute clinicians, and that could really extend to community health workers as well, but have training people to be alert at the frontline level, and as one of the levels of the workforce training is really getting people to be aware and astute and able to use data and understand why they need to look at data to pick up on new things in an outbreak response. So really more attention paid to the frontline workers and raising their awareness and capability.
But also, again, Peter, just to extend on that, this idea of citizen surveillance and
absolutely
not have community workers and health workers as the only ones. I mean, it really is this idea in One Health that everybody should be looking around at the environment, should be looking around at health risks, should be taking care of each other and looking out for each other. I mean, it's a fairly broad thing, but it is, it's going to be much more effective if we're all in this together and we teach early on how to keep our eyes open and what's important and what to do with that information, and then how to interpret that information.
Yeah. And certainly in the COVID era now, we're seeing, and this veers into the technology aspect, but a lot of opportunities for the community to contribute data, observations. I mean, everything from the app on my phone where I check in with the state of Pennsylvania, says I feel good today, and then I get feedback, on the number of cases, et cetera, et cetera. I mean, that's obviously
why you should worry.
Yeah, right. No, but the point is that there's a lot of these things that are being developed that could be leveraged and really empower the community. So I agree. I think it's a good point.
Can I
go ahead?
Say,
yes, Victor?
Yeah, I was just reviewing again the title of the year panel. It says improving outbreak response and preparedness.
Right.
For me, one of the key words is improving. We need mechanisms to measure that improvement. Otherwise, we're just, I don't think we'll be able to make that materialize that investment. And one of the things that we've been trying to raise is the importance of gathering. We've been saying this, but gathering, monitoring, evaluation data as we implement different interventions. So I'm not talking about surveillance data. I'm talking about performance data on the multiple interventions. What is the rollout of contact tracing? What is the rollout of vaccination and multiple interventions, and how we utilize this data on the go in real time to inform step by step the different processes and making improvements on a daily basis, rather than just waiting at the end of the outbreak to make a review. This is a critical field that we're trying to improve, as well as bringing operational research capacity on the go as well. Over.
Yeah, I agree. I mean, we don't just throw money at it. We want to see if that money is working, if it has value. Catherine?
Yeah, just really quickly. I mean, I think in the response, in terms of improving it from a One Health standpoint, we have to look at how do we leverage those One Health platforms, which are really powerful in bringing together, different sectors, and they're already on board. And but it's things like biodiversity sensitive responses. So you don't have, communities or authorities going out and killing, bats or wild birds in response to public fear. Or, I think that there's kind of the gut reaction, and then there's the scientific reaction that really needs to have the right sectors at the table to make those decisions and design the appropriate response. I think also community engagement, the anthropology aspect, that is so critical during an outbreak response, but also, after and before, and getting your communities to be engaged in that process and trust information. I think just lastly, the after action review opportunity, making sure that sectors are involved in that are, haven't traditionally been at the table and can look at how do we improve from, past outbreaks. I think we'll get a good sense right now of how to do that going forward. Thanks.
Okay, good. Well,
yeah. No, can I?
Go ahead, Olga. Go ahead.
Yeah. In the sort of the poor countries and poor communities, animal health is very important to the people and the families. We heard yesterday that may be more important than human health. And many countries do have village animal health workers. These are usually volunteers. They are not paid, but they are provided with some resources by the Ministry of Agriculture to attend to animal diseases in the villages, where it makes a big difference to the communities. And during a response, during avian flu at least, was extremely valuable to have these, animal health workers. They got cell phones and they reported outbreaks, basically, in from settings where the government would have never been present to, detect and report an outbreak. And there's also a lot of synergy with the village with the community human health workers, because these villages are small places. I mean, sometimes it's the same family. The husband works for agriculture, and so the One Health preparedness and One Health response may be, sort of, if some resources and attention are put into these networks of village health workers, then it could, be very beneficial for surveillance and also for response.
Okay, thanks, Olga. I think we're back to the main meeting now. So I want to thank everyone. Obviously, not enough time for full discussion, but thanks very much for your input.